that says, imagine a world without COVID. I do want to imagine one. I was in New York during the first wave of the pandemic when it hit the United States, after being in Italy and before that in China. When I came back to India in April, my intention was to use the lessons that we had learned abroad in order to start building capacity and helping out both the healthcare professionals here as well as the infrastructure. After that, I went to Mumbai with an international humanitarian aid organization called Doctors Without Borders and spent about three weeks with them at this 1,000-bed COVID hospital in Mumbai, where we assisted both in the wards with our team, but also with our team we're able to train nearly 300 or more doctors and nurses in some ways to emergently see COVID patients. The healthcare infrastructure in the United States is definitely much more advanced, but we were still caught unawares to some extent when the first wave came to New York after being in China and then Europe and Italy. Our system was overwhelmed by the number of patients, but we still had enough doctors and nurses. We still had a manageable caseload. In India, what we've seen is that our existing infrastructure has been massively overwhelmed just because of the number of cases we've seen. With that, our supply chains, our oxygen supplies, everything has been stressed. The differences also are that I've seen the people have gone above and beyond here. The doctors, nurses, techs, anyone who's worked in the hospitals here, anyone who's worked outside the hospitals in helping tackle this wave, even the civilians have gone out of their way to help each other and to help people out, which is really encouraging. Now that the cases are lower, I think it is time that we take stock of the situation and we continue to build our capacity. We continue to train and rest wherever it is possible.